Rear-ended, whiplash, neck pain, sleepless nights. Hey, sound familiar? If you've been in a rear impact car crash, this is the episode for you. We're going to talk about low speed impacts and what goes on during the sequence of a car crash. You may be dealing with neck pain, brain fog, all sorts of different things. But here's the truth. There is help, and you can start doing home therapy right away using BioWave GO. And in this episode, we're going to talk about it. So stay tuned.
Welcome to the Defeating Pain Podcast with Dr. Ted Arkfeld. If you're tired of treatments that just don't work, you're in the right place. Each week, we'll talk about new ways to beat chronic pain using at-home therapies. You don't have to go to the doctor to feel better. Let's help you start living pain-free. Now, here's Dr. Arkfeld.
Most patients that I see that have been involved in a rear impact collision, they usually say, there was hardly any damage to my car. How can I be hurt? The car doesn't absorb the energy like the body does. And so we're going to talk about what happens when a car that you're driving, that you're unprepared, and you get hit from behind. What exactly happens with your head and neck? And what are the forces acting upon that? More importantly, what are the structures, the anatomical structures that are going to be injured? And then what can you do at home to begin the healing process? You're going to want to get a BioWave Go because it's going to get you out of pain. It's going to get you moving and get you sleeping pretty quick. So, what happens in a rear impact, even such a small speed as 10 miles an hour? So, you're just sitting there, you're pretty much unprepared. You don't know you're going to get hit. When the impact occurs, initially, you're going to go back into your seat because the head and neck and the body, they go in what they call the principal direction of force. The principal direction of force is from the car that just hit you. So you're going to go back into your seat. Now, at a certain point, your seat is going to load up with energy, and then it's going to act almost like a springboard, and it's going to launch you forward. And about at the proper time, or maybe the worst time, yeah, the proper time, because if you don't have your seatbelt on, you would keep accelerating into your steering wheel. But what happens with your seatbelt, it acts as a braking mechanism, but it also acts as a fulcrum. Then your head can go forward very quickly, injuring the muscles and ligaments in the back part of your neck. So if you're unprepared, then you have no way of preloading your ligaments, which do not have good vascular supply. They're not going to heal up really well. They're going to take the brunt of the energy transference, the energy coming from the striking car into you. They're going to take the majority of that energy. It's called kinetic energy. And then the way your body is moving, we call that kinematics. Okay, so what happens? So you go back, your head gets ramped back, then you go forward, and you're stretching very quickly, milliseconds. You're causing a stretch, a rapid stretch on the muscles and on the ligament. And then if it's severe enough, you can actually damage joints, facet joints. Now, for years, chiropractors always gave a diagnosis of sprain of the muscles because they got tears in them, sprain of the ligaments because they got tears in them. But I always thought that was too simplistic. I have treated thousands of personal injury cases. That's what I did in Phoenix, Arizona for 13 years, is that I specialized in treating motor vehicle accident cases. And I always knew it was more than soft tissue because patients came with a myriad of symptoms. They would have headaches, they could have brain fog, they could have dizziness, they could have concentration problems, they could have irritability, they could have sleep disturbances, they could have visual problems, trouble with focusing, they could have light sensitivity. You know what a lot of these symptoms sound like? If you said concussion, you were right. Because yes, you can achieve a concussion or sustain a concussion in a rear impact motor vehicle accident. It doesn't have to be sports related. As a matter of fact, I would say there's a lot of concussions that go misdiagnosed because the providers are not looking at it that way. They're looking at what's going on with the neck. I will also tell you, you cannot have a concussion without having neck problems. So you're always going to have neck problems with the concussion. And I would even say the majority of the symptoms are originating from your cervical spine. Sorry for the digression, but let's move back on. So you get into the motor vehicle accident and you think it's not bad. I'm just a little stiff and sore. And you wait a couple days and then whammy, all of a sudden those symptoms hit and they hit hard. You wake up with stiffness and soreness in the neck. You can't move. You're having a terrible headache. That is what we call a delayed of onset of symptoms. Then a couple days later, it hits and it hits hard. That is a rear impact collision, what we call cervical acceleration deceleration injury at its finest. So you go to a chiropractor, let's say. That chiropractor, at the very least, should do a very thorough exam. He should be doing range of motion studies. He should be doing orthopedic tests. He should be doing a full neurological evaluation on you. You should have x rays, a minimum of 7 views of the neck and 2 views of the upper back. Then a treatment program to alleviate the acute symptoms. Now, this is where most chiropractors are not aware of BioWave GO, and it is far superior than a TENS unit. Here we go. The BioWave GO is our number one go-to for pain relief. As a doctor of chiropractic, I cannot prescribe medication, but with the BioWave GO, I don't need to. So how does this thing work? When you injure the muscles, you have little tears in the muscles, you have little tears in the ligaments. That's going to elicit the receptors in those structures to turn into what we call nociceptors or pain receptors. That's going to start the pain going. Then you're going to have inflammation and a chemical cascade occurring. What BioWave Go does is it goes on there, pardon the pun, it creates a what do I call a force field and a buffer. And so the pain signals going from those structures, they can't get into the spinal cord and on up to the brain where you'll perceive it. What does that allow you to do? It allows you to shut off the inflammatory reaction. It allows you to start moving better because you can actually start, and I encourage us, I've always encouraged early movement therapy with my personal injury cases. So you've got the BioWave Go on your neck, and you can start doing just little movement exercises like that. That's very therapeutic, and you can do it multiple times during the day while at home. You throw the BioWave Go on right before you go to sleep, and then you can get a great night's sleep, which is huge when recovering from a motor vehicle crash. So the BioWave Go is, again, absolutely important for home therapy, and you, by all means, can initiate that on your own. If your doctor of chiropractic does not have it, has never heard of it, share this episode with them and tell them, get the BioWave Go. He can order it in the link below. So this is going to help with your neck stiffness, with your headaches, concentration difficulties, even with a concussion. This will start the neurological input to help with the concussion. I'm not saying BioWave Go is going to be the only thing you need to treat the concussion, but it sure can help you with your home therapy. I recommend at least 2 to 3 times a day. In severe cases, I'll recommend you put the BioWave Go on for 30 minutes at a time. You wait an hour, put it on for 30, and you just keep going back and forth and hit it hard, along with some ice applications. You do that, and over the next 48, 72 hours, I'm not saying you're going to be totally out of pain, but that pain is going to be reduced and you're going to be well on your way to healing. That will make whatever your chiropractor is doing so much more effective. So, if you've been rear ended, if this sounds like what you're going through or what you have gone through, BioWave Go may be the answer. If you have questions, comment and tell me about what's going on. I'll answer the comments. We may even have to get on the phone and you tell me what's going on. I'll tell you what I would recommend. So if you want to start recovering and take into your hands your therapeutic interventions, if you want to take and control what's going to happen, because let's face it, when you've been in a motor vehicle accident, everything just seems to be out of your control. Now you're dealing with an insurance company. You may have an attorney. You've got to go see the doctor. You've got to get your car repaired. You may have to take time off work or from school. You may be out of your athletic events that you want to do. It's just such chaos. You know how I know so much about this? I've been in 7 car accidents myself. I've been through it. None of them were my fault, but I sure know a lot about what it means to wake up the next morning and your neck and upper back are so stiff and sore. I wish I would have had BioWave GO back when I was going through all these car accidents. So if that sounds like something that interests you, again, the BioWave GO will be in the link below. A lot better. So again, if you like what you're hearing, give me a comment and hit the subscribe button. More importantly, tell other people. If other people have been involved in a motor vehicle crash, it doesn't have to be a rear impact, it can be any type of motor vehicle crash. Let them know about this episode. Let them know about BioWave Go because we're all in this together and we're going to try to defeat pain. Hey, and the only thing you have to lose is the pain. I'll see you in the next episode.